enhancing the hips and the butt is now quite a common request from patients nowadays. Okay, so we have what we call the BBL, Brazilian butt lift, and the butt augmentation. Okay, what's the difference? Okay, actually, here it has come to the understanding of everybody that the Brazilian butt lift is actually harvesting fat where you don't need it, usually abdomen, sides, and then processing the fat and injecting it into the butt or the hips. Okay, so basically it's fat grafting or fat transfer. Okay, so while butt augmentation, the usual butt augmentation is using butt implants similar to breast implants, but shaped differently. Okay, it's more oblong. Okay, and then you actually make a small incision about this long between the butt crease, the butt cheeks. There's a crease line there. Okay, you make a small incision, create a pocket inside the muscles of the butt. Okay, these muscles are responsible for climbing stairs. Okay, and you put the implant there. Of course, just like breast implants, you can choose any size. And the patient actually is very important. The patient's desires are very important because we follow them what size they want. No? Okay. And then when we do the butt augmentation, okay, we usually consider the size of the chest, circumference of the chest, because the bigger the chest, the smaller the butt becomes. So sometimes you need to balance that with a butt implant. Who is a good candidate? No? Okay, if you have large upper torso, like large breasts, and you don't have a nice butt, okay, you're a good candidate. Okay, and most Asians are like that. No, we really don't have the Latino butt or the Latino hips. Okay, and this can, however, this can be enhanced with a BBL or a butt augmentation. Okay, so the ideal patient for a BBL is somebody who has lots of excess fat, because we cannot harvest fat from another person and transfer it to you. Harvesting fat aggressively in the waistline will make the waist very small, makes the butt relatively bigger, and transferring that to the sides for the hips and the butt actually completes the reshaping of that area. A butt augmentation, just like any other surgery, okay, we encourage the patients to be up and about. Okay, move right away. Maybe you need to rest for a day or two, but actually patients are encouraged to be active. No? So most patients are up and about by the second or third day. They are requested not to put pressure on the area, but of course they can sit, okay, and lie down on it. But they have to turn from side to side from time to time. Okay. So basically, after the butt augmentation or BBL, patients are basically, what limits their movement is the discomfort and the pain, but not because they're not allowed to. Okay, so about a week's time, most of these patients are pretty much back to their usual activities, and I require about 10 days to 2 weeks before they can fly out of the country, so I can observe them some more. After the butt augmentation, whether you put an implant or you do fat transfers, okay, patients can go back to work after about usually 5 days to a week. Again, it depends on the work of the patient. Okay, if it's just office work, wherein it entails sitting down long periods of time, we just advise the patient from time to time rest your butt, walk around a bit. But you can definitely go back to the office after 3 or 5 days. Okay, when can you exercise? The rule of the thumb again is, okay, do start your routine exercises as soon as you feel comfortable with it. Will the new implants affect how they function? Of course, initially yes, because it's uncomfortable during the first week, but after that, patients are allowed to do anything they were doing before, lifting heavy weights, doing physical activities, okay. Any physical activity they did before, you should be able to do it. Otherwise, what's the use of having a nice butt when you can not do the things that you like to do? How long will the implant stay there? Okay, if you do a BBL, okay, and the fat survives, and we will know how much of it will survive after about 2 weeks to 3 months, okay, the fat that survives stays there your lifetime, no? Okay. If you gain weight, that area will also become bigger, and if it's too big, you can also remove the excess fat by liposuction, okay. Butt implants, like breast implants, can stay there long time. Okay, no need to replace it every 5 or 10 years. You replace it only if you want a bigger butt. Okay, so pretty much it lasts your lifetime already.